This is incredible. Everyone should feel what it is like to feel this connected to everyone.
You've likely heard of the drug ketamine. Originally discovered in 1962, it's used in hospitals for surgeries and procedures of all kinds. In the 80s and 90s, it became a very popular party drug, but today it is being used as a treatment for severe depression, anxiety, PTSD, chronic pain, and more. MedCircle producer Brigid and myself went to Beverly Hills, California to get our very first ketamine infusion treatments. It was incredibly eye-opening and insightful, and I hope you find the same insight in this documentary. If you've not subscribed to this YouTube channel, please do. It helps us spread this credentialed mental health information to those that need it. Enjoy this program, and remember, whatever you're going through, you got this. Ketamine is a research-backed medication that's providing a fast path to relief from mental health issues for patients who just have not responded to traditional treatments. But not everyone is a candidate. Before we received our infusion, Brigid and I underwent a thorough screening process with the doctor. We also consulted with our personal psychiatrist.
Hey, doctor.
Hey, Kyle.
I'm Kyle. This is Callie.
Hey, Callie. I'm Dr. Stoyer.
I'm Brigid.
Hey, Brigid. Nice to meet you as well.
That's one pack.
It is, yeah.
So they ask for all the normal stuff, and then they go through your mental health history, which most doctors don't ask in this much detail. And then they go through your general history as well. And then just now, you're going to take the Beck's depression inventory to see how depressed you really are. I know people who've had ketamine because they were in a hospital going into a procedure. But I don't know anyone, I didn't even know ketamine was a street drug until we started to do this story. Let's see what my anxiety score is. So I filled out the Beck depression form and calculated my score. And it's a score from 1 to more than 40. And I'm a 36, which puts me in the severe depression category, which, considering my history, does make sense. Then I did the Beck anxiety form, and on a scale from 0 to more than 36, I am a 26, which puts me in moderate anxiety, which is between 22 and 35. So I'm on the low end of moderate anxiety, and I'd say that's true. I most of the time I'm not very anxious, so that seems in line with how I actually feel and view my own mental health.
My name is Dr. Michael Stoyer. I'm the founder and owner of the Pacific Ketamine Institute, PKI, here in Beverly Hills. I'm an anesthesiologist in terms of my background. I did my anesthesia residency training at Harvard, Massachusetts General Hospital back in the 80s and early 90s, and I've been in practice for approximately 32 years.
And we just did 20 minutes of paperwork between the two of us. We give it back to you guys. What are you using that paperwork for?
We want to make sure that ketamine is safe for you, that there aren't any so-called contraindications or medical aspects of your history that would preclude you from having ketamine infusion. Somebody with uncontrolled high blood pressure, somebody who's allergic to ketamine, which is very unusual, somebody who has, let's say, schizophrenia, somebody who has a problem with their liver, let's say somebody has hepatitis or liver failure, because ketamine is metabolized by the liver, it wouldn't be appropriate for something like that. Ketamine is very useful for depression and anxiety. It's also used for PTSD. It has been used for addiction disorder. It's been used very frequently for bipolar disorder. It's now being thought to be helpful for migraine and certain types of neuropathic chronic pain. We've seen tremendous benefit from people who've been very frustrated with the traditional modes of treatment for depression and mood disorders, depression, anxiety, OCD, where people have really felt stuck using SSRIs, SNRIs. What are SSRIs? Drugs like Zoloft, Prozac, etc., Lexapro. When you first start your initial ketamine infusion, what we'll do is we'll bring you back into one of our very comfortable deluxe rooms where there's a very comfortable reclining chair.
Here we go, ladies and gentlemen.
We're going to pre-treat with a drug called Zofran, which is a very powerful anti-nausea drug.
Okay.
Sorry about that.
And are there any side effects of getting Zofran besides not feeling nauseous?
That's pretty much it. That's a nice side effect too.
And I'm getting it right now.
I'm going to give it to you in a second.
I'm not afraid of needles or blood or anything like that. I talk when I'm nervous, so.
That's okay. It's normally nervous for this.
But you know, nervousness and excitement are the same emotion. It's just on different sides of the coin, so to speak.
Yeah.
So I think it's just excitement.
That's right.
He's like, yeah, that's what you gotta tell yourself.
We tend to dim the lights because during ketamine infusions, patients' senses tend to be very heightened. You tend to hear sounds, noises much more intensely than if you had not been on ketamine. The same thing is true with the visual experience of ketamine. So we tend to really kind of mute the experience so that it's not overly sensory overload for you. People are always a little nervous the first time. After that, it's like, I know what to expect.
Okay.
But this is like nothing you've ever experienced before, so you know, it's understandable you'd be a little bit nervous about this. I would be.
Yeah, and I've never done it recreationally, so I have no idea what to expect.
Here we go. I feel nothing yet.
Okay, we are plugged in and ready to go. Can you feel it yet?
I think so.
Pretty soon it's gonna be more than I think so.
Okay.
You're just starting to get there. I'll be back in a few minutes, okay?
Okay. So what should I do right now?
Just kick back and relax.
Okay. Have you asked me anything?
How's it going? How does it feel?
Incredible.
What are the thoughts that are in your mind?
That we're all connected, that we're all together, that like it's just so clear, like we are all in this together.
What is this? We're all in this together. What is this?
Well, I mean, like our lives, our purpose, our soul. We're all, it's crazy how we're all together.
Yeah.
I can tell that I'm very everyone should feel what it is like to feel this connected to everyone. It's incredible. On a science level or a neurological level, what's going on during the treatment?
During the treatment, ketamine is known to modulate the so-called glutamate receptors in your brain. Glutamate is an important neurotransmitter in the brain. It's an amino acid. It's one of the building blocks of protein, but it also is involved in the signal processing of brain chemistry. And it tends to open up different foci in the brain, different areas that help make you feel much better in terms of your mood.
How you doing, Kyle?
This is this is incredible. Yeah. This is amazing. I wish people could hear what I'm hearing right now. You know?
Totally. What does it sound like?
I just I feel really like grounded. I want to go back where I like got it.
Do you already feel a lot more normal?
No, I can still feel the effects of it right now. That was incredible.
How's your mood right now?
It's pretty good. Yeah, I feel.
Compared to usual, let's say on a scale of 1 to 10, with 10 being the most, just the best you could ever imagine feeling, completely euphoric. Where would you say you are now? On a scale of 1 to 10, where would you say you were before?
Before I was probably at a 5. I would say now I'm at 8 or a 9.
Beautiful.
Yeah.
That's awesome.
Yeah, I feel I had a lot of anxiety coming here.
Mm-hmm. Do you feel more calm?
I feel a lot more calm. I typically have an anxiety that follows me everywhere, and I don't have that at all right now for the first time in a really long time. So.
That's really fantastic.
Yeah.
Good.
Yeah, it feels really good.
I made a believer out of you.
Yeah, you did.
Ironically, I feel clear-headed, even though right now I know I'm not clear-headed.
You're clear-headed but sleepy.
Yes, exactly. Right. Yes. I mean, just really incredible experience. Really, wow. Just, man, I didn't want that to stop. I didn't want it to end. I want to stay in that space of like.
Let me ask you a question. On a scale of 1 to 10, with 1 being the worst and 10 being the most happy, the most relaxed, most calm, where were you before and where are you right now? On a scale of 1 to 10.
I don't think you can use a scale for this.
Off the charts.
I don't think a scale is a good measuring tool for this 1 through 10. It doesn't work for this.
Not linear.
It's too great. It's too great. Now I feel it's probably been 30 minutes since our treatment. I feel a little dizzy and actually a little nauseous.
Oh, really?
Yeah. It's not bad or overwhelming, but I wouldn't want to go for a jog right now, or I wouldn't want to read a book. You know.
Fortunately, the nausea passed in about 30 to 45 minutes, and the days following, I felt noticeably better. I wrote down my thoughts and recapped the experience in an article that you can read using the links below. Brigid also shares her experience with ketamine infusion treatments, whether we would do them again, and how long we notice the positive effects from the infusions. Again, you can read that and more using the links below. Would you ever try a ketamine infusion treatment? Leave your answers in the comments section below. And thanks again for watching.